Hi everyone, Dr. Nemechek here. I want to talk about constipation. So, for the most part, we've all been trained by our mothers and our grandmothers that constipation is not only a problem down here, symptom down here, that's where the whole thing starts, actually. And we know now, with the exception of maybe some bowel obstruction from scar tissue or something like that, which is uncommon, constipation is a neurological problem. Now, sometimes you get bacterial overgrowth with methane producing bacteria. The methane will actually injure the regional nervous system, and constipation arises from that. But more often than not, constipation is coming from a process in the central nervous system in the brain. As an example of this, we know when adults get a mild to moderate concussion, about 50 to 70% of them are constipated in the first week after getting hit in the head. Okay? And so if you have a neurological problem up here, it takes a while for it to recover, like a few months to several months. It's the same thing. These kids I talk about have the low blood pressure in the brain. That's coming also from the same region of the brain. It's the autonomic nervous system. And that takes several months to many months to recover, okay, to get the blood pressure regulating correctly. So the constipation you see in a child and is from this nervous system problem. That's why it's so bad, okay? Where, kids have to go to the emergency room sometimes or be hospitalized because of the constipation. The brain is not correctly telling the intestinal tract, like if you think of it like a conveyor belt, to push things along the way. Now, here's one of the things that happens when you have bacterial overgrowth. So my thing, you have the fish living with the birds. As a generalization, that tends to give you loose and more frequent stools. All right? Now, if you have constipation, where you have fewer stools, maybe harder stools, and you get bacterial overgrowth that gives you loose and frequent stools, they kind of cancel each other out to a great degree. Now, things may not be perfect, but they are problematic. The diarrhea from the overgrowth is reversing any symptom of constipation you might see. Now, what happens is you use inulin or you use rifaximin to balance your bacteria, and people will write me and say, the inulin caused constipation, okay, or the rifaximin caused constipation. Really what happens is the inulin and rifaximin, by virtue of balancing the intestinal tract, make diarrhea go away, even though you may not see it so much that you think about that word, but it's because it's offset by the underlying constipation. So basically, by making the loose, frequent stool go away, now you see the constipation. So when you see constipation occurring after you start inulin or rifaximin, it's a very positive thing. Okay, now it may be a nuisance. There may be a problem in some way. You got to use some Miralax or magnesium or something. I'm not doubting that. But it means the rifaximin worked. It means the inulin has worked in balancing the intestinal tract. Okay? All right, that's the takeaway. Constipation after rifaximin or inulin is a positive sign that that treatment is successfully balancing your intestinal tract. All right, good little pointer. Everybody, have a great day. Take care.